McCune Albright syndrome is a disorder that affects the bone, skin, and several hormone producing endocrine tissues. It is caused by activating mutations in GNAS1 gene, which encodes the alpha subunit of stimulatory G protein. As a result, the mutated cells proliferate. Affected cells migrate or expand as the embryo is formed. One bone or many bones, plus minus endocrine organs, are affected. The McCune Albright syndrome is a triad of precocious puberty, endocrine hyperactivity, fibrodysplasia, and capillate spots. People with the McCune Albright syndrome develop areas of abnormal scar like fibrous tissue in their bones, a condition called polyostotic fibrous dysplasia. Polyostotic means the abnormal areas or lesions may occur in many bones. Often they are confined to one side of the body. Replacement of bone with a fibrous tissue may lead to fractures, uneven growth, and deformity. When lesions occur in bones of skull and jaw, it can result in uneven or asymmetric growth of the face. Asymmetry may also occur in long bones. Uneven growth of leg bones may cause limping. Abnormal curvature of the spine or scoliosis may also occur. Bone lesions may become cancerous, but this happens in fewer than 1% of the people with McCune Albright syndrome. In addition to the bone abnormalities, affected individuals usually have light brown patches of the skin called capillate spots, which may be present from the birth. The irregular borders of capillate spots in McCune Albright syndrome are often compared to a map of coast of Maine. As compared to McCune Albright syndrome with the capillate spots, the spots in other disorders have smooth borders which are compared to the coast of California. Capillate spots give coffee with a milk appearance. Here we have mnemonic of disease associated with the capillate spot. The mnemonic is he never played with pigments, which mean hypothyroidism, neurofibromatosis type 1, polyostotic fibrous dysplasia in McCune Albright syndrome, and Peutz-Jeghers syndrome. Like the bone lesions, the capillate spots in McCune Albright syndrome may appear on only one side of the body. Girls with the McCune Albright syndrome may reach puberty early. Management of McCune Albright syndrome. In fact, there is no cure for McCune Albright syndrome. Treatment may include medication to manage pain, treatment with medicines known as bisphosphonate to improve the bone density, vitamin D supplements to reduce the risk of rickets, regular and supervised exercise program to improve the bone density, physical therapy to maintain or improve the joint mobility, medication to reduce the level of female sex hormone like estrogen, hormone therapy or surgery to treat a pituitary tumor, hormone therapy or surgery to treat gigantism, surgery to bolster affected bones with grafts, pins, casts, or combination of procedures, surgery to remove the ovarian cysts, surgery to remove abnormal adrenal glands in the cases of Cushing syndrome. Now, this slide shows the whole summary of McCune Albright syndrome. It is caused by activation of mutation of GNAS gene. The classic triad include polyostotic fibrous dysplasia, autonomous endocrine hyperfunction, and capillate spots. The management include the use of aromatase inhibitors, for example, testosterone, selective estrogen receptor modulator like tamoxifen, estrogen receptor antagonist like fulvestrant. If you have any query in your mind, write in the comments section. Subscribe on Obs and Gynae and follow our Facebook page of on Obs and Gynae. Thank you so much. Allah Hafiz.